Before the Wuhan virus reached the U.S., it had already started to spread across Asia. On Tuesday, the U.S. Centers for Disease Control and Prevention announced that a man in his 30s living in Washington state's Snohomish County, north of Seattle, had contracted the virus. The man had recently returned from a trip to China and is now in good health. "I think it's laudable that the Chinese authorities have identified this quickly," Hyzler said. "There seems to be a good sharing of information."
Passengers traveling to the U.S. from Wuhan are being rerouted to one of 5 airports. The CDC announced Tuesday that 5 U.S. airports, New York's John F. Kennedy International Airport, San Francisco International Airport, Los Angeles International Airport, Hartsfield, Jackson Atlanta International Airport, and Chicago O'Hare International Airport, will be screening passengers for the virus. Airports in Hong Kong, Singapore, Thailand, and South Korea are also screening passengers for fever.
Travelers should avoid close contact with people who are sick, particularly those with cold symptoms. Some people who contracted the Wuhan virus reported symptoms including a fever, chills, headaches, and a sore throat. A few said they had difficulty breathing. Travelers should try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, such as coughing or runny noses. What we don't know as to what extent this disease can be transmitted by people who are only mildly ill, Toner said. Wearing a mask isn't particularly helpful, Toner said. Many people in China have lined up to purchase face masks, which have reportedly started to sell out at some stores. But Toner doesn't think masks will do much to protect anyone's health. "There's little harm in it," he said. But wearing masks, except in the situation of a healthcare provider, has never been shown to be a very effective way to protect yourself from infectious diseases.
The CDC warns travelers not to touch their eyes, nose, or mouth with unwashed hands. Travelers should wash their hands frequently with soap and water, making sure to scrub for at least 20 seconds, the CDC says. There are no vaccines to protect humans from contracting a coronavirus. There is no cure for this virus, Hyzler said. If there is a vaccine, it'll take years.